Dr. Martinez, I'd like to talk to you about, when people have gum disease, a little bit or a lot, starting with gingivitis, little sore gums and whatever, all the way up to very heavy gum disease, also called periodontal disease. And what every dentist keeps saying is, you've got to get rid of it because you lose your teeth. And you have talked a lot about what losing the teeth means. Falling in face, of course, lots of money to replace them. However, you also have mentioned, and it's very clear, that dentistry today is pretty very, very good in replacing teeth, implants. So it's not like George Washington, who apparently was wearing a wooden tooth. That must have been awkward and awful. But I don't know whether he did. That's the story. I really don't know whether it's true. But anyway, so on one end, yes, you can replace them, and if you kind of don't mind the money, I don't know why anybody wouldn't mind. So what if the teeth fall out? Because you can replace them up. But it looks to me that while this is happening, 1, 2, 3, 5 years, whatever it takes to get to that point where the teeth starting having to come out, you poison your body. You have an infection. It's that yellow, reddish, ugly buzz right in your mouth, right at the gateways of your mouth, dripping into your blood, going to your liver, going to your kidney, and poisoning your body all over the place. It looks to me that is much more awful than losing the teeth, even though that isn't exactly sugar on the cake either. Tell us about it. Well, what's your feeling about that?
Well, you actually touched on a very, very important subject for me. Yes, we've talked about replacing teeth, and yes, we've talked about aesthetics and the pain and the joints and all that, but you also mentioned, which to me is probably the most important, is why replace the teeth if you can prevent losing the teeth? And one of the things I try, and I think I've tried for over the last 19 years as a dentist, is to try to educate people on the importance of keeping your teeth. And one of the ways of doing this is having regular checkups, regular cleanings. If you already have gum disease, which I see a lot of people that already have gum disease because of the reasons I mentioned before, where people have never been to the dentist. If you can still be in a stage where you can do something about it, why not? The good thing about gum disease, if there is such a thing, is that it's a very slow progressing disease. It's a very forgiving disease. It takes years usually for people from the beginning stages of gum disease to the end stages of gum disease. So you have many years to do something about it. You can actually turn it around. Now, the bone that has been lost due to gum disease, because by definition that is what gum disease is, doesn't come back. Although there's treatments now that we are providing, so then I shouldn't say that, but for the most part, let's say that the vast majority of the bone that has been lost does not come back. But if you can prevent any further bone loss and all that pus that you're talking about, all that bacteria from building up, why not? And I think that is probably the most undertreated area. I think a lot of people think that it's normal for gums to bleed. And I say I think it's because I hear it from people all the time where they say, oh, I know, my gums bleed when I brush my teeth. And I always ask, do you think that's normal? They say, well, they've always bled. They just think that it's because they've always bled that it's normal. And my answer to them is, if you washed your hands and they bled, would you run to the doctor and try to do something about it? Well, it's the same scenario with the mouth. It should not bleed. And so I believe that is probably the most important area to educate patients. People can still do something about it depending on what stage of gum disease they're in. And actually, you can have all stages of gum disease in your mouth. You mentioned this before, we normally take care of our front teeth a whole lot better than we do our back teeth. And typically what we see is that the front teeth are not so bad, they can still save them. And if, you're at the final stages of gum disease on your back teeth, well then if we need to lose them, we need to lose them. But also I find that a lot of people want to hang on to what they have because it doesn't hurt. That's probably one of the disadvantages of gum disease. For the most part, gum disease does not hurt. I always tell people, if gum disease hurt, it would be packed in here 24/7 because pretty much, I would say 8 to 9 out of 10 people have gum disease, some sort of gum disease. They all expect when I say that everybody's going to they're going to lose their teeth, and that's not what I'm talking about. As I said earlier, gum disease there's different stages of gum disease, and we all have different stages of gum disease. And so it comes in all forms and shapes, and I know by having been doing this for such a long time that 8 or 9 out of 10 people have some sort of gum disease. So and it's easily treatable.
Sorry, let me ask you. So if somebody has this infection in the mouth, which I've heard, you mentioned it, like if you're washing your hand and they would be bleeding. So if you would have anywhere from toe to the head, you would have like almost a handful of infection which has yellow pus coming out. You would run to the doctor. In fact, people do run to the doctor for an ingrown toenail, which is a little bit, swelling up and whatever, which is good, that they should. But they have that much and more in their mouth, and they're not running to the doctor. They're not fixing it. And thus, all this, an infection creates a lowered immune system. I have heard that there is ladies who have premature babies because they had gum disease. In California, there even was a lady who had a stillborn baby because they found the gum disease stuff in her placenta. Now, that's a very, very rare case, and we don't want to scare anybody, as such. It's super, super rare. But if that super rare stuff can happen, wouldn't it be logical that, yes, it brings down the immune system, you're more fatigued, there will be another flu season coming up, it might not, hopefully not be the swine flu or the bird flu, but there's just the normal winter flu season coming up, and wouldn't that kind of like be, at least to some extent, contributing to you perhaps catching the flu easier?
Yes. Exactly what we've been saying all along. It is so hard for me to understand as a dentist, as a healthcare provider, that people are not doing anything about their problem. You're absolutely right about all these issues, their immune system being compromised. But again, I think we equate having a problem with having pain. And if we don't have pain, why fix it? And I think that is probably the biggest problem I face. I would tell you that, when I see a patient that hasn't been to the dentist for 3-4 years, and they're in the beginning stages of gum disease because of what the exam I've done, and they're starting to probe and bleed when I do the exam, but they're having pain. I always tell them, you don't know how lucky you are that you're starting to have pain at this stage. Some people are just more sensitive. Some people are just less tolerant to pain, and so they'll respond when they start having pain. I always tell them how lucky they are, because most of the people that I see that are starting to feel anything, it's when it's too late, because the teeth already started moving, and every time they chew, the teeth move to one or the other side, and that's really the pain that they're starting to have. But by then it's too late. And you're also right about the correlation that with the stillborn. And you're right. We don't want to scare people, but there have been studies, and they have been linked to premature with babies. And again, it doesn't happen to everybody, but why risk it happening to you? Also, the same thing has been correlated to heart disease and the diabetes. Why risk happening to you because of not treating your gums?
And as you said, there's no pain. There's most of the time no pain with a heart attack either, and they keep saying a sudden heart attack, which is a misdemeanor, because there's no such a thing like a sudden heart attack.
Exactly.
I mean, it has been building over years.
Or a minor heart attack. Yeah, no.
It has been. It has built over years. It's not sudden.
Exactly, and it's hard to understand why we're all human beings, and the last thing we want to do is spend our time at the doctor's office. And I think it goes with everything, with going for our annual checkup. But I think that it's very, very important that we do. I think, especially having been a provider of dental treatment for many, many years now, I don't understand why people won't want to have their teeth until they die. Nice.
Well, here we go.
Teeth.
Here we go, Dr. Martinez. Again, another topic very rarely looked at by most of us patients. Gum disease. If you want to have more energy, want to be more immune to your next flu season, want to prevent your kidneys and your livers from getting poisoned from that yellow, ugly, reddish pus dripping into your blood, heart attacks brain strokes type of stuff. It's not that those things are the only thing why people get it, but don't you want to rule out every contributor to any of those things? Makes no sense. So I would say, why don't we just end this video so I can get my butt to a dentist, huh?
Absolutely. Thank you.
Bye-bye, Dr. Martinez.
Bye.